Thank you. Good morning, everybody. Thank you for having me today. I'll keep my mask off so I can speak. I get tested every single day. I'm good, and we're obviously more than 6 foot apart, so we're safe. Um, just to give you guys a little background, I was a former associate professor at University of Florida for several years, and was a national speaker for Johnson & Johnson and Pfizer for nearly a decade, and been owner and CEO of Avicena since 2005. We have been at the forefront of COVID since it happened in March. And it was kind of a crazy, wild west time to think about it. It was only a few months ago, but there was a period of time where pretty much all medical practices closed down, even regular urgent cares, primary care offices, all specialists closed down. We actually got a call from the mayor's office because our offices we have, in St. John's, Duval, and Clay County, and literally like, could you guys please stay open because we were afraid that there's going to be a run on the hospital. And at the time, there were no supplies, there were no testing available, and I had a meeting with my staff, and we had to, I wanted to do it, but I also had to make sure I have the buy-in of the other 50 people that work for Avicena. Everybody at the time, this was at the point where we thought the world was going to end. I knew this was the plague of the century per se, and we decided that, hey, we're in medicine to help. And I actually kind of gave the example. I said, it's like imagine being in the Navy SEALs, and when it's actually go time, you say, I'm going to sit this one out. So we decided we paid, 5 times what we should have for our PPE and got everybody protected and stayed open and never closed a single day, since all this stuff happened in March. We have since then have treated thousands. I mean, there was a point sometimes in May that St. Johns County Health Department and called us and said, we have tested more people than Flagler Hospital and any other entity within St. Johns County. We invested heavily to have our own analyzers and our own machines to be able to test in-house, because literally even up to a couple of weeks ago, if you sent your tests out to Quest or LabCorp, you were waiting 7 to 10 days for your results to come back. And unfortunately, COVID, because it acts as a Trojan horse in a sense that almost 50% of people that get contracted, they contract the virus, are completely asymptomatic. So 7 to 10 days is really not good to walk around infecting everybody else until your results come back. And usually by the time actually 7 to 10 days your results come back, most people that are going to get better are already feeling better. So it's almost a waste of time. So we knew that to really stop the propagation of the virus is to nip it in the bud as quickly as possible. So the quicker you can identify someone that's positive and have them, self-quarantine, that is what stops the propagation of, the virus. What we've seen during this last 7, 8 months or so is that majority of people do very well. And we've had multiple deaths from patients that have come to Avicena since March. And every single one of those people have been someone that had significant underlying health conditions. I have not had a single person, I haven't had a single person even end up in a hospital that didn't have underlying health conditions. And you'll hear, age-wise, all these different risk factors. Health factors are way more important even than age. I have plenty of 70 and 80-year-old patients that have had COVID, got over it just fine, but I've had 40-year-olds that ended up in the hospital for a week or two because they've had chronic asthma since childhood. So I would 100% put underlying health conditions way above age. If you're just a generally healthy person, and again, when we say a lot of people think they're healthy, but they're really not because they haven't seen a doctor in 5 years, 10 years, and they just think, if I had $1 for every single time someone came in and said they're healthy and I checked them and they had glucose intolerance or pre-diabetes, I would stop working. So just because you're walking and breathing and not in the hospital doesn't mean you're healthy. So I want to make sure we qualify that. But assuming that you are healthy, 99.9% do very well. The first person that actually ended up in the hospital was a St. Johns County deputy who came in and he had three problems. He was significantly overweight, he was a type 2 diabetic, and he had chronic asthma since childhood with multiple hospitalizations due to his asthma. So significant lung scarring. And that's a person that's just not going to do well no matter what you throw at them. That's the person that ends up in the hospital due to influenza. And every single year we lose 60 to 70,000 people due to just your good old flu A and B. So this, if anything, should be more of a wake-up call to everybody to kind of get your health in check, to get your weight in check. There is a large-scale study was done in New York that showed if there was one confounding factor they could find amongst everyone that ended up on a ventilator was they were all overweight. Nothing else. You could throw everything else, every risk factor out the door. Obesity was the number one risk factor if you were going to end up in a hospital. And a lot of that has to do with most people, and again, it's nothing in medicine is 100%, but majority of people that are significantly overweight have glucose intolerance, which is you're kind of pre-diabetic or diabetic, and you're just not, when you're in that situation, your body is just not able to fight off infections properly. And, this is kind of what happens. If you remember back at the beginning, that first wave of COVID that hit the United States, if you remember, was that Princess Cruise Line that was sitting off the coast of California. And there were all these jokes like, buy a week of cruise, get your second week for free, because they wouldn't let anybody get off the boat. That was kind of the first, almost like a group in a petri dish that we could evaluate, and it's a really good group to study because you could see what happens when you put 3, 4, 5,000 people in an area and they're all commingling in very tight spaces. Out of that 3,500 people, when they tested them, a little over 800 people were positive for coronavirus. What was more interesting than the 800 people that were positive, 54% of them didn't know they had it. They had completely zero symptoms. So, and again, that's the ticket. Every single day I have people coming in. Well, I feel fine. Does that mean that I can't pass it on? Absolutely not. You certainly can pass it on if you're asymptomatic. I mean, when we're swabbing you, we're actually checking for the particles of the actual live virus. So if those particles of virus exist in your nasal cavity, whether you're symptomatic or not, once that leaves and enters somebody else, it can set up, an infection. We had just 3 weeks ago a very unfortunate situation. We had a 51-year-old gentleman who had ulcerative colitis and rheumatism. So he had 2 immunocompromised situations. He was on 2 different immunosuppressant medications. Now, if you saw him on the street, he'd be healthy than anybody else. Slim, trim, like I said, 51 years old. Again, people are not walking around with a sign on their head that what their underlying health conditions are. We saw him on a Sunday, and what had happened was his son, who was 19 years old, came from college, and his son was asymptomatic and gave him COVID. So his son was positive, gave it to the whole family, including his 51-year-old father. Wednesday, he ended up in a hospital and died the following Sunday. I mean, in 7 days, he went from walking into our office, just having a little bit of fever and chills, to 7 days later, gone. And what sucked was that the son is the one who gave it to him, and he has his own now demons to battle because he thinks, oh my God, it's my fault that I gave it to my father. And that's kind of the message we like to pass on to our patients that we see, is that it's not really you that you should be worried about. It is that one unsuspecting person that you come across, your parents, your grandparents, someone that doesn't have to be, like I said, elderly, someone that, people don't wear their medical information on their chest. You have no idea what someone's underlying health conditions are, if they're on immunosuppressants. You'll see advertisement for these immunosuppressant medications every 5 minutes, Humira for, rheumatism, for your, every medical problem right now is treated with some kind of an immunosuppressant, and they're widely prescribed, and patients that are on those medications really don't do well with um, with viral infections, particularly something like COVID, which attacks the lungs when it gets out of hands. So I just wanted to kind of give that little brief intro. And I know everyone here, either on an individual personal level or regarding gate hospitality, may have their own questions. And I like to kind of um, move the rest of the talk in that direction of what things that you guys would like to for me to talk about, because I can talk for the next 6 hours regarding this. So I want to make sure we hit the areas that would benefit you guys the most. So I'll just kind of open the floor, and we can talk about from all aspects of testing. What are the different types of tests out there? Why would one want to do an antibody test? What's a PCR test? Antigen test? What are accuracies? What are active treatments? So there's many categories I can talk about. So I'll just kind of leave the floor to you guys, and we'll go that way. Sure. Yes, ma'am. And the answer truly is we don't know. And here's why. So your immune system and how you're able to fight viruses and bacteria are, without getting too nerdy in this discussion, you have your B cells and your T cells. So you have B cell immunity and T cell immunity. And when we check for antibodies, we're checking for B cell antibodies, which is what you hear, your IgG and your IgM antibodies. So what we have found is that the milder the disease that you have, the less antibodies you produce. And it kind of think about it makes sense, right? If we have an intruder in the country that is a very small force, it's not going to upset our defenses as much, versus if we have a real major threat, we may have to beef up significantly more against it. So most patients that we see that had a very, very mild disease process, or they barely had symptoms, sometimes you check them and they don't even have antibodies. Like you check, it takes, so, and that's the misconceptions. Patients come in and like, I want to get my antibodies checked. Why? Did you think you have a prior exposure? No, because I want to. And antibodies cannot be used to rule you out of a current infection, because it takes roughly 3 to 4 weeks for you to develop antibodies post-exposure. So just because you were sick last week or 2 weeks ago, you wouldn't have enough antibodies to build up. Antibodies are great to look at kind of rear view mirror 3 weeks and so prior to that. And in March, April, we had quite a few patients that had gotten sick in January or February, and at the time there was no way to test for COVID. Obviously didn't even know about it. And we had one specific patient who was in New Jersey in January, got sick as a dog. We tested him for everything under the sun. Everything was negative. And of course, when that happens, you just blame it on the 77 other viruses that are around. I mean, as we speak right now, there's adenovirus, there's rhinovirus, there is your regular common cold, which is your regular coronavirus. That's not the 19 version. And I can name about 13 other ones. So there's many viral things that happen all the time that people get sick that we just can't identify because they're self-limiting. We did an antibody test on that patient in March, and they were already positive, which means what they got back in January was they had COVID-19. And we know it's been stateside probably, very, very late December, early January, particularly in New Jersey, New York. But again, we still don't know what, case zero is. We just know it happened way before March. So it's good for things like that, but it's not good to clear someone. Now, the question comes, okay, let's say someone has been exposed to COVID, had a disease, whether mild or not, and they either have very minimal antibodies or no antibodies. Can you say if that person is now re-exposed to COVID 5 months later, how are they going to respond? And that's what we quite don't know yet, because what we can't test for is your T cell immunity. And that's what I started with. So you have two types of immunity. You have your B cell and T cell. And it's almost like your branches of your military. Imagine if all you could look at was just the Army and not know what the Marines are doing. So just because Army's not going to war doesn't mean Marine can't protect you. We just can't test for it. So we can't sell T-cell immunity. The belief is that even if you have minimal antibodies or your antibodies wane over time, which they will, we've seen quite now that it's been long enough. We have had patients that had very high level antibodies in April, and then we check him now, and it's half as what they had. You know, it's already declined by 50%. But again, there is no there are no studies or data to show how much antibody do you need to prevent a reinfection. You know, like, do you need, you know, it's almost like it's not like a light switch that's either on or off. So if you had 20% of what you started, does it still protect you? Does it protect you a little bit? Do you have less of a disease? And so on. Just like people that catch shingles or they have a herpes outbreak, this is a virus. Usually their first outbreak